You're watching Good Day Orlando on Fox 35.
Losing weight, it's great, of course.
But what about you losing weight in all the wrong places, and then you have this additional thing? Look at that. This is what we're talking about. You're left with droopy, hanging skin. So you lose the weight, but then what do you do with the skin, right? There is a solution. A local doctor will join us to explain this coming up next. Don't go away. All right, ladies and gents, because it goes for everybody. When you lose weight, you feel great, right? But there is a side effect to losing weight. And sometimes you lose it in the wrong places, and that means a lot of extra skin, things you don't know what to do with. Reality star Khloe Kardashian just lost a lot of weight, and then she went on record saying it's really led her to want to get breast enhancements and to get other work done. And to join us this morning to talk a little bit more about this, the after effects of losing weight, is our good friend, board-certified plastic surgeon, Dr. Armando Soto. Great to see you. Thanks for coming.
Thank you.
Okay, so yeah, we encourage people, lose the weight. You'll look better, you'll feel better, but as you know, because you get to see this all the time, there is this side effect of skin. And what do we do with it, right?
Exactly, yeah. A lot of times after you lose more than a little bit of weight, your skin loses its elasticity, is what we call it. It loses its ability to shrink after you lose the weight. And so depending on how much weight you lose, the genetics of your skin, your lifestyle to that point, and other variables, including how much weight you lost, the skin will sag. And that really, you know, I saw a patient just yesterday who said, I've done all this hard work, I feel like I'm in really good shape, but I don't look as good as I feel I should, and it's because the skin obscures their new shape. Okay,
so what parts of the body are easiest to fix, and where do you often see the trouble spots? Here, right?
Yep. So a lot of times you'll see it starting at the head, you know, down. The breasts will sag in women. In men, you know, the chest will sag in ways that are not attractive and they don't like. The arm skin will sag. The torso skin really sags a lot. So circumferentially, the abdomen, the hips, the lower back, it'll all sag down.
The neck too?
The neck too, but to a lesser extent, usually unless the patient's older. It's usually really from the shoulders to the knees that people see the worst changes with weight loss.
Okay, so if I come to you and I'm like, okay, I'd like to get some of these areas fixed, do you do it all at once, or how do you tackle that?
No, I think, you know, whether we're talking about weight loss patients or any other kind of plastic surgery, it's always important to prioritize the patient's safety, number one. And so there is a limit to how much you could do on one day. And you also want to time it appropriately so that they get the best eventual outcome. And there are things that you would want to do before others so that it's possible to get the most natural appearance in the end.
Are any of these procedures, or could they be covered by your insurance because of the weight loss, or how does that work?
It's very rare for that to be possible. You have to be able to prove to your insurer that removing the skin is going to actually improve your long-term health and decrease your long-term usage of the healthcare system. It's very hard to do that from excess skin, so it's usually an out-of-pocket expense.
How about recovery from these types of procedures?
Some of the procedures are very small, and in fact, we're doing a lot of this in the office with non-surgical treatments nowadays. The larger procedures to change the shape of the breast or to tighten the skin on the torso, those things, generally speaking, will require an overnight stay at the facility and pain medicine for maybe 4 or 5 days, 6 weeks to full recovery.
Okay. Dr. Soto, great information. How can our viewers find you?
Best place is my website, which is www.drarmandosoto.com, and we're also very active on social, so you can find us there.
Great. Always great to see you.
Nice
Thank
to
you,
see
sir,
you too, Amy.
for
My
giving all this
pleasure.
great information to us. We appreciate your time.